So, we will discuss about chronic myeloid leukemia in this video. So, what is this? Chronic myeloid leukemia. Alright. So, there is myeloid. Alright. And chronic. Chronic means long term, usually greater than 3 months. Alright. So, if some cases is greater than of 3 months, then that comes under chronic. Alright. And what is myeloid means? So if you know, there is hematopoietic stem cells, alright, and that goes under myeloid series and lymphoid series, alright. So there is overproduction of progenitor of myeloid series, especially FIL, WBC's FIL. Alright, so what are those? So first one is eosinophil, and that is immature one. Alright, so there is immature eosinophil, there is immature basophil, there is immature neutrophil. Alright, so instead of fully matured these cells, there is immatured this granulocyte WBCs. What might be the reason? And you should also know that myeloid series that which also give the RBCs and other. Alright, so you must know now why this happen. So there is translocation of gene. Alright, translocation of gene from 22th chromosome to 9th chromosome. Alright, and see how what changes. So see, very simple. To remember the gene, you need to know AB and BC. Alright, and there is L and R. So L and R. So AB, BC. And generally in Robin's pathology, it is given as BCR and ABL. So this is the main gene which is responsible for this mutation. So what actually happens? The chromosome segment ABR is present, alright, on 9th chromosome. Alright, so ABR is present, ABL is present, and it produces a limited amount of one enzyme. So ABL gene is responsible for making ABL kinase. Alright, that is tyrosine kinase. So what happened? As the ABL gene binds with BCR gene, by unknown way, this starts to make a lot of ABL kinase, and after making a lot of ABL kinases, what happened? The hematopoietic system is just get overwhelmed, and it starts to make too much of granulocyte. Alright, and the progenitor of platelets as well, that is megakaryocytes. So these two are just start to forming in the rapid fast way, and granulocyte, in a granulocyte, especially eosinophil and basophil. Alright, so these two starts to form at very higher rate. So okay, so now let's talk about laboratory diagnosis. Alright, so in lab diagnosis, in microscopy, if you'll prepare peripheral blood smear, So what you'll find there will be a lot of eosinophil and basophil instead of um, their normal amount. And you can also found the megakaryocytes, alright, which is the progenitor of platelets. So these two will be actively forming, and there will be more amount of this. Erythropoiesis will be, means RBC formation will be a bit of depleted or might be normal. So this will be finding out in the microscopy. Other lab diagnoses include PCR and chromosome analysis test. PCR is most preferred test in this one, so this can be called as a standard test or gold standard test. All right, so PCR help us to determine it helps to actually confirm that the case is of CML. Now if we talk about the signs and symptoms, so no, let's talk about the clinical features. All right, so if we talk about the clinical feature, it might be generally present in the patients of 50s to 60s of age. All right, and peaks in 50s to 40 to 85 cases is maximum. All right, so this is the age group which are generally affected. Okay, so it is usually okay. So the median survival life is 3 years. All right, so those which are just confirm that they have the CML, they will survive to around 3 years of life. And it has median 3 phases, that is the starting phase, and then after there is blast phase. This is the final stage. All right, in which there is very less chance of survival, and it occurs after accelerated phase. All right, so there is continuation of accelerated phase, and it lasts for around 12 months, and abruptly blast stage started. We don't know when blast stage started, but it started just abruptly. Then after, if you talk about the treatment, so now we know that cause is BCR-ABL gene. All right, so we give the drugs which are inhibitor of BCR-ABL. All right, so such drugs are given, and around 90% of case shows progression, or you can say 90% of cases are just shows that they have the medicine is working, and side effects are very less, are tolerable one. It is like tolerable, so very minor side effects are there. And this medicine just lengthens that accelerated phase, or you can say as delays accelerated phase and blast phase. All right, so this medicine generally helps to prolongs the life of the person. So I hope I could make almost everything clear. There might be still something to see. You can refer Robbins for further detail. All right, so Robbins is gold standard, we all do know that. So you can see, Robbins,